Everybody in the Bay Area deserves Newsom Eyes. That is certainly what the team at Newsom Eye believes. They are a premier provider of laser eye surgery and comprehensive eye care. And joining me this morning to talk about dry eyes is Dr. Hunter Newsom and Dr. Eric Fazio. And in the morning, in the middle here is patient Mickey Webster. Good morning. Welcome back. I love when we're hearing now from patients and hearing patient stories about how you really are. I mean, it's life-changing, I think, when you are talking about these different eye issues. We're talking about dry eyes this morning. This is a huge problem for people.
It is a huge problem.
For doctors.
For doctors. I know we were just talking. So dry eyes is a big issue, and I actually have dry eyes. So you don't only have one patient, we have two patients here. Dr. Fazio treats me for dry eyes. And really, for me, it just, as I talk about it, my eyes want to get itchy and dry and scratchy. You want to rub them. You wake up in the morning and they're dry, and they can also affect your vision as well. So I can notice one of my eyes is a little bit blurry. You try and rub it and clear it up or blink a little bit, and then it does better, and it just kind of comes and goes. So I knew that as a doctor, and Fazio's put some plugs in my eyes to help treat me a couple of years ago, because I used to have a bottle of drops in my pocket at all times, and if I didn't have it, I felt, oh no, what happens if they get dry? So he treated me, and then I don't have to worry about having those drops all the time and as frequently. So it's been a plus. The
treatment, from what I understand from you and your team, has changed kind of dramatically over the years, correct?
Yeah, it's really 3 patients here. I'm a patient too. Yeah, it's changed a lot. I mean, the problem with dry eye is most people that when they finally get to me, they've gone to the store and they've seen the 80 eye drops and they've tried 10 of them and they're like, what is going on? You know, my eyes are burning. I'm looking at the computer use has gone through the roof. So that's what's changed a little bit too environmentally. You know, we're looking at our cell phones or devices, kids are. So you're getting that evaporative dry eye just skyrocketing. But in terms of treatment, a lot of things have happened. You know, we talked about this before, but we kind of started rolling out this stem cell treatment really is why she's here as well. Mickey's here and thankfully here, and we appreciate that. But it's really using your own blood to use tissue growth factors within that to heal your cornea. That's ultimately what dry eye does. That's pretty awesome. I mean, punctal plugs is something that's also very advanced. It's a micro device you can insert in your tear duct and reservoirs tears. So that works very effectively. Dr. Newsom, that works for him. That actually works for me. I have those. But there's, you know, that's part of the exciting new stuff is the stem cell stuff. There is another level above what Mickey had here, which is called Procara. That's actually amniotic tissue that you can place against the cornea and really heal those severe cases. Certain patients have diseases, like Sjogren's syndrome is a common one where they get really nasty dry eye. So that's an awesome new stem cell treatment that is FDA regulated. You know, and we do all the right things to make sure we're doing things, you know, within the FDA, of course. But this is awesome. It's really exciting, and it's happy to help people that really have been frustrated with dry eyes and they just hit a wall.
Well, and let's talk about that, Mickey. Tell us a little bit about your story. And you said this kind of started a couple years ago.
Yeah, it did. Actually, before I got the serum tears from Newsom Eyes, I did try all these eye drops that they're talking about. Not just the ones that you can get over the counter, but even prescription eye drops. And for me, they just did not work. It was like a temporary Band-Aid. I was using them constantly. Actually, there was a period where I was using eye drops every 30 minutes.
Oh my goodness.
Either prescription or over the counter. It was every 30 minutes. It was horrible. Even at night, I would wake up every couple of hours and I would have to put drops in my eyes because, like Dr. Newsom said, my eyes were so scratchy and irritated. And
now, though, let's hear how you feel now before we run out of time.
It's really amazing. The serum drops they're more than just masking the issue. What I feel like when I use the serum tears is that they are healing my eyes. I really feel just a healing taking place.
You can just tell how the joy in her face was. I mean, it is. It's life-changing.
It really is. It's life-changing. If you suffer with dry eyes, I encourage you to try these serum tears. I have tried everything. I've tried multiple different types of treatment, and for me, this is what worked. It really did make a difference in my life.
Well, and as we kind of wrap up here, doctors, I mean, how do you find out if this is going to work? Obviously, this is what the outcome we need, but how do you find out? What's the best way to find out if you're candidate?
You have to have the skill to look at the eye, you know, unfortunately. It really does, you know, when you look at an eye and you can just, you know, a lot of doctors do throw the tears at it, you know, and you'll see dry patients. If you look at ophthalmology as a whole, they'll jump between 5 practices, patients like Mickey, before they get a solution. So we like to think we set ourselves apart. I mean, you don't want to tap yourself on the shoulder too much, but you know, we do a good job assessing it.
When it's
you have
deserved,
to kind of, you have to kind of pick the dry eye and you treat it differently. Everyone's different.
Makes a huge difference in the patient's eyes and their life. It really does.
Well, thank you for coming in and sharing your
My
story.
pleasure. I
And
like
again,
to
I
tell
hope
everybody.
more patients can see the joy that she's seeing as well. If you have questions, they have locations here in the Bay Area. There is one of their addresses, phone number, website as well. Thank you both so much for coming in as well, doctors. We appreciate it. Look forward to seeing you again soon.
Thank you.